Is there any question that I can answer quickly before we begin the next training? And here we'll be talking about the Tarasoff principles and court cases that will be on your test. Okay? Is anything about the scope of the standard or confidentiality? Or anything else that I can quickly answer that's in your mind? If not, it's totally okay. We'll give it 2 minutes and we'll be back again and zoom through all these other topics in the next hour and a half. And then immediately after we conclude today's event, I'll stand by for any questions about the course or any questions that you feel that needs improvement or you're not sure about. Okay? We'll begin in 2 minutes again. I'll just close my camera for now, but I'll be here to answer a question if you have one. So this topic is super important, and I would take the time to memorize each of those cases early, right? Because if you get a question and is number 160 or so four towards the end and talks about different court cases and they'll mix and match it, the language, you may get this question wrong. So it's very important, like Erickson, that you don't wait to memorize that at the end. It's very important that you like, oh, I kind of know and kind of get it. These things that are several cases or several stages of development, like Erickson, you need to memorize it early, not just kind of know. Okay? So it's a mistake that we're like, okay, I got this, this, and that, but I kind of know. When you walk to your test, to take your test, you need to know those cases, Erickson, those long subjects in detail. Don't wait for the week before the test to try to memorize it. Put that as a priority. Okay, we're about to begin. And here we are going to talk about the Tarasoff Principle. First thing I want you to know is the Tarasoff Principle was a court case. So from now on, when they say the Tarasoff, I will never say the Tarasoff versus Regents, right? I'm trying to save brain space. What the board will not do is say Tarasoff versus Reagan or another court case. They will not mix the court case name. So therefore, you can memorize the whole court case, or you just can call it a Tarasoff. The Tarasoff is a principle that says duty to warn potential victims of imminent dangers of homicidal client. However, not every state requires enforce this principle. So what does it mean? When you take in the board, it's national. If it is not required by every state, usually you do not report, or you report to the nursing board, which seems super vague, or authority, in the case, the police. Because if you report to the nursing board for more guidance, no one can stop you for that. So it is always the right answer. If you report to the police, it is always the right answer because you're looking for guidance, and that applies to every state. So the Tarasoff Principle, right, equals to duty to warn. So in the last few decades, the law have improved to benefit the patient's right in general. Another law principle that you need to know and be mindful of is called habeas corpus. What does it mean? It is unlawful to detain without a due process. Well, what does that mean? A lot of statutes guarding the mental health patients against being detained or hospitalized unlawfully. Back in the day, anyone could pick up a patient and say he's dangerous or schizophrenic. Let me just hospitalize this patient, right? So if the patient says, I want to invoke my right of habeas corpus, that means you have a certain amount of time to bring this case to the court to decide whether the patient should stay or not. Very important that you know what habeas corpus is or means in mental health, regarding mental health, right? So here's the case, O'Connor versus Donaldson. As I said, going forward, I'll just call it the O'Connor case, right? So that way, a little bit more mental, saving your mental power for what's important. So the O'Connor case was a patient, a mentally ill patient that was confined in a hospital for 15 years without, against his will, while he was not a danger to self or others. Again, being schizophrenic does not give the right to confine someone if they are not a danger to themselves or others. Okay, so when you hear the O'Connor, think of a guy that was hospitalized for 15 years. And he said, I want to leave. And the hospital said, you can't because you're mentally ill. But if the patient is not a danger to self or others, and he's able to survive on his own, hospitalizing this patient is illegal. Taking his freedom away is illegal. Okay? The lines can be very blurry here. Okay? So we have to really look for when and how to detain a patient.
Dr.
So
Lopez, I'm sorry, before
go
we
ahead.
move, when you say the lines can be very blurry between, I think, the habeas corpus and O'Connor, I feel like they're going to kind of trip us up or trip me up, on
Yeah.
board between these two, because they both are very similar. And I was
Yeah.
wondering, is there anything that I should look out for, or how can I, like, if they have both of these in, I guess, the answer, I guess maybe I would just have to read the question and kind of see what they're asking and get rid
Yeah.
of the fluff, but they're so similar. I'm just having
They are very similar. So here how you differentiate. A patient is hospitalized and he evoke his right for release. Which of the following consent or which of the following measure court cases would this case most likely applies to? Now is referring habeas corpus, whereas unlawful detention without a due process, meaning that the patient said, I don't want to be here, and you said, yeah, you have to be here, then we got to now take this to the court. He evoked habeas corpus. Now, when the case, when the question says that someone was hospitalized without being a danger to self or others, which of the following cases this most likely applies to? This is referring to the O'Connor. So a mentally ill patient cannot be confined against their will if they can survive outside, right? Just be mental illness alone does not justify involuntarily hospitalization. Okay, so I think the question would not put those two cases together because they are very similar. But just know that the patient can evoke his right habeas corpus, and the case that says illegal detention when someone can survive outside is referring to O'Connor.
Ah,
Hopefully that helps, unless if anybody else has a different way to differentiate those two cases. This is how I would look out for. But it's very good that you realize how they are closely related. So by realizing that, you are acutely aware that can be one or the other. Just you have to read the question and look for cues that would be one or the other, and most likely they will not be in the same question. Okay. Now, other things related to court cases, right? Patient's right. What are the two, really, is actually three, but I will say two here. Two, patient's right. Patient has the right to least restrictive environment, and patient has the right to informed consent. Okay? What are the two patients' rights? It's not necessarily involved in court cases, but it's high yielding information. The two patients' right, least restrictive environment, and informed consent. Now back to court cases. Other than you have to memorize reigning versus claim. I call it the reigning case. It has to do with the right to refuse any treatment and use an appeal process. Well, I'm schizophrenic. Do I have, I don't want to take my medication. Are you going to force the medication in my throat? No. I have the right to refuse medication. If I say no, it's no. Which case I'm referring to? Raining. Okay? Oh, but you're schizophrenic. You don't know what you're doing. Well, I still have the right to refuse medication. Now, what we're going to do? We're going to appeal to the court, and the court will decide. Okay? Roger versus O'Keen. The patient has the right to refuse treatment, but a guardian may authorize the treatment. So I'm 17 years old and I say no. And I'll call the mother and say, look, the patient's schizophrenic and needs this medication. Would you authorize me to give the medication, even if the patient doesn't want to? The mother says yes. So the guardian has the right to authorize the treatment. So a little bit different than reigning versus claim case. Okay. So what is your question there, man?
So is this apply the Roger case? Is that applicable only to underage
Yes.
individuals? Oh, okay.
Yeah, because otherwise it would have been the reigning case.
Okay, okay.
So how you differentiate the Rogers case is minors, and the parents or guardian may authorize. The reigning, it says, hey, I don't want to do it. I don't want this treatment. And you, the clinician, think is necessary. Now you are going to appeal this process in court. Okay. Durham, the Durham versus USA, the Durham case. Individual not criminally responsible if the unlawful act was a product of mental illness. Now we can get this all over in our head and start debating things. Oh, so if he's mentally ill, schizophrenic, and he killed somebody, does it mean he's not responsible? I urge you not to get into the rabbit hole here. The question, you're not a lawyer, neither am I. The question will be, clear cut for you. So the Durham versus USA, it says the individual not criminally responsible if the unlawful act was a product of mental illness, and leave it at that. Let's not get into the rabbit hole, okay? Because we can get very deep on this one, right? Everybody agree? Because everybody knows somebody that's mentally ill and committed a crime, right? But it has to be proved it was, let's not get there, okay? Just know that German mentally ill patient cannot was not cannot be responsible if the product of the crime was due to the mentally ill process during that time specifically. Okay. Now the Ford versus Wainwright cases, the patient must be competent to be executed, right? To be killed. They must be in their sound state of mind. Okay. So we have to memorize those cases early.
Dr. Lopez,
Yes.
if you want to go back for just a moment,
Sure.
it's helped me, to kind of remember these like
Please.
right off the bat, if you guys want to hear it. So the first one that's was easy for me was the Klein one. As in Klein and decline. So remember Klein, decline. Perfect. So you have the right to refuse. All right, you declined. So the Oken, the one on the next one, kids love to do the okie doke on their parents. So an okie doke just means try to fool them. So I remember Oken, okie doke, Oken, and that sure you can refuse the treatment, but I'm the parent or I'm the person responsible. So you will be getting this treatment, sir. On that one. And then the Ford one is back in the day, if you drove a Ford and it wasn't that great, Ford stood for find on the road dead. So I just remembered it by, well, this Ford has got to work for me to kill it, but usually it doesn't. So that's how I remember Ford and execute it. But anyway, it's helped me. I just thought I'd pass it along.
Yeah, I really love the claim and the oaking, but the Ford, remember, Ford cannot die. Meaning the Ford must be competent to be executed. That's the only one that I would tweak a little bit. As Ford cannot die.
Yeah, but right? That Ford's got to work because this never worked for me. I always had Fords found on the road dead.
True. Yeah. So another case that you will absolutely see on your test. This one's a classic, must be on your test in one way or the other. It's the Stark law. Why must be in your test? It's because we all must be aware of this, that we cannot benefit from patient care in an unlawful way. So let's get some details. So it cannot refer a patient for monetary gain, or pharmaceutical companies pay off student loans. It would be an example, right? Then you work for the company and provide samples to the patient and provides company sponsored education to get paid. So here an example. I refer my patients, this is real life, I refer my patients to psychotherapy. And when they get referred, they get called in and say, these are the people that are screened and qualified for you to get psychotherapy. Which one would you prefer? I cannot say you should go here or here, right? It's illegal. I gotta provide the list. Usually, I can definitely not say, go here, this is the best place, my sister owns it, and it is the best place. That would be against the Stark law. Okay, so here it basically means, think of it, money under the table. When you hear Stark law, it means money under the table. Okay, so think of this as if you benefited from providing a treatment in any ways, if you got money, if you got a cruise, if you got a hotel, all this would be illegal. Okay? Even if it's the best treatment, even if it's the best treatment, it is still illegal if you benefited from providing the medication, the treatment. Don't do it. And this why it must be on your test. I guarantee you, it will be on your test, one way or the other. Different examples, different ways, but it will be on your test because it's very, very important. So another thing that you must be mindful is the American Disability Act of 1990, ADA. So what does it mean? It stops unfair treatment of people with mental illness. So in relation to jobs, hiring, firing, or promoting someone due to the mental illness, in replace in cases of places like restaurants, store, transportations, programs, schools, libraries, and service, and it aims for equal opportunity for everyone. Now, the law can be a little bit more, that's grossly speaking, right? Now, if I have just one employee or two employee, obviously I cannot accommodate for that, right? So it has a certain, like you have to be certain how big, and there is more details to it. But generally speaking, ADA is American Disability Law, saying, hey, you cannot fire someone due to mental illness, okay? Or hiring them due to the mental illness. So it's a civil rights law for people with disability for the entire lifespan. So people with disability are entitled to help and reasonable accommodation. That's the key, reasonable accommodation. People who in previous generations have been institutionalized can now be productive members of societies with some of these accommodations available. Okay, just remember that. Now, as we move on, think of four P's as a story that I like to say. Basically means the Tarasoff Principle. We remember duty to warn. H for Orbis Corpus means protect against unlawful detention. O, O'Connor, cannot confine mentally ill against their will if they can survive. That's the difference here. Survive, right? So if it's a schizophrenic patient, oh, so I cannot detain him? It depends. Can he survive or not, right? Or is he a danger to self or others? Or for the right, the patient has two rights. I want you to remember this because it's very important, although not specific to the law. The two rights that the patient has, the least restricted environment and informed consent. And the P for perfuse, meaning Rainey versus Klein, the right to refuse treatment. The D is for the Durham, not criminally responsible if the act was due to mental illness. So we're on the D. So FSS, for you to remember, is the Ford. F for the Ford, must be competent to be executed. Or Ford cannot die is how I try to remember, or the other example provided. S for self-refer. S for Stark law. You cannot self-refer for monetary gain, even if it's the best treatment. Even if your sister is the best brain surgeon in the nation and the patient needs a surgery, you cannot say, you should see my sister. Illegal. If you benefited in any ways, I think that is more, if it's more than $25, we're not going to get in details. But if you benefited in any way, that is the Stark law. And the last one is a sample conflict of interest with the pharmaceutical companies. Usually, questions regarding the Stark law has to do with pharmaceutical companies providing benefits. Okay, because that's big, and that happened many times in the past. Ask your question, please.
Yeah, Dr. Lopez, I have two questions.
Sure.
For the Roger versus Oken,
Okay.
what about if the schizophrenic patient is conserved? And court appointed conservatorship, would we still go through the conservatorship as a
Right.
guardian, or is it just strictly the youth?
So you're saying which case again?
For the Roger versus Oken, that the patient can refuse, but if the guardian okays it, then the guardian pretty much wins. But what about if that guardian is a conservator?
Yeah, I think now we are getting to the rabbit hole. Okay, because in of these cases, there can be exceptions, right? So I would not necessarily answer that. I would think that it still applies because if the guardian is the person responsible for the patient at that time, well, it would apply. But then I think these cases we can get in deep, very deep rabbit holes, especially the Durham cases, right? Or Ford, or even the Roger. Or I mean, all of them we can get very deep. I would warn you to stick to the definition in a simplest manner because the test will not try to confuse you on that one because they're like, okay, they're not lawyers. So we're not going to get in details.
Okay. And
Okay.
then my second
Yeah.
question for the Stark law,
Yeah.
I saw a question and it was, I was stuck between two answers because it was one of the answers was you are paid by the pharmaceutical, you pay the pharmaceutical company to educate regarding the medication. They 1,500 or something like that. And then the other answer was you give a $10 gift card. You get a $10 gift card. So I was stuck between both.
So I think is a $25 limit. That'll be okay. Like let's say you went to a conference and the conference was about Zoloft. I'm just picking up any medication, by the way. I mean, that's not true. And they provided you a meal to learn about Zoloft. And later you prescribe Zoloft. That's not a conflict of interest, right? Because you went there to get more education about the medication. Now, 1,500 is definitely a no-no. Okay, so you said the person paid the pharmaceutical company. I'm not sure what does it mean, or if the person got paid by the pharmaceutical company, right?
The person got, yes, that's what I meant.
Okay, so definitely a clear cut, a no-no, Stark law. So there is a limit. I believe it's $25.
Okay, got it.
It's a small amount, a gift card. Hey, thanks for attending today's conference. And they send you, $10 gift card. That's okay. Go ahead, take it. Okay, it's not a problem. Now, 1,500, anything more than $25, it becomes very clear that they're trying to influence you. Okay, so how would you? I hope that was helpful. So, how would you put all this, because it's a lot and you have to do it early, in perspective? Think of this way. I made up this. If it helps you, great. If it doesn't, throw away. In the legal land of mental health metropolis, a renowned judge named Torpifus upheld the law with a just and fair hand. So in his rulings were always guided by the principle that formed the acronym again, Torpifus. If you have a better acronym, please do it, which the T stands for the Tarasoff. The judge Torpifus always reminded the town people of their duty to warn others if someone posed an imminent dangers, reflecting the Tarasoff principle. Remember, Tarasoff Principle does not apply to every state, so you have to be careful. Habeas corpus, he protected the citizens from being unlawfully detained without due process, ensuring their liberty and mental health were safeguarded. What else did he do? Well, O'Connor, in his courtroom, Judge Pidfus decreed that mental illness alone cannot justify involuntary hospitalization, echoing the verdict of O'Connor versus Donaldson. The R for the right. He championed patients' right. Remember the two rights. Insist on the least restrictive environment and informed consent for all treatments. The P, perfuse. Judge Pifas upheld the right to refuse what? Treatment as signified by the Rainey versus claim and ensured citizens could appeal the decision. And the D, for German, he ruled that individuals were not criminally responsible if the unlawful act was a product of mental illness, as defined by this case. So again, the F for Ford, Judge Pitford declared that the person must be competent to face execution, aligned with the Ford case. The S for self-refer, Stark law, he was strict against self-referring for profit, upholding the Stark law. The S, Judge Pifas was vigilant against influencing of pharmaceutical company. Stark law most of the time involve pharmaceutical company, prohibiting practice that could lead to conflict of interest, right? So if you remember torpede fuss, you could potentially remember all the cases and be able to say it by memory. If it's helpful to you, keep it. If you have a better way, please share. Could someone please read this question and answer and try to answer this question, please? Anyone? Any volunteer or not? I'll read it. Okay. In a recent outpatient consultation with the PMHNP, a patient displayed an aggressive behavior towards his boss during a heated argument that escalated into a physical violence. The patient later expressed an intention to cause harm to his boss upon returning to work. What would be your appropriate action as a PMHNP in this case? Would you think that A, reach out to the patient's employer to address the potential for dangerous behavior? B, would you ensure that the patient agrees to a no harm agreement? C, firmly discourage the patient from contacting his boss. You cannot contact your boss. Or D, consult with your local board of nursing to assess potential risk. Who thinks is A?
D.
B, ensure that the patient agrees to a no harm agreement. Who thinks is B?
D.
Me.
Okay.
Me.
All right. So D is the answer, right? Remember, the Tarasoff principle does not apply to every state. In here, it's talking about the Tarasoff principle, the duty to warn. And when you are pinned against a question like that, always look for calling the police. No one can stop you for that. Or asking for guidance from the state board of nursing. So the same question, exactly the same, with a twist. If the question had, he called the nursing board for more guidance, That was in the question, the stem of the question. Now the answer would have been duty to warn his boss. Well, how is that so? Because now the question is implying that you are aware of your state regulations, even though it doesn't say you are completely aware of duty to warn. But if it says that you sought, you sought some guidance of your state regulations. So basically now it's saying the Tarasoff principle applies to specific this question. Am I clear on that? Because it can be very vague. So now is the time. Right? So
Dr. Lopez,
yes,
so why isn't it A, since we have, I mean, it says the duty to warn.
because it does not apply to every state.
So in this question, how do we know what state?
Exactly. Because you don't. Because it's national board.
Okay.
So the tweak here is if this question had said you search your state board of nursing and you are completely aware of the duty to warn, or sometimes not even say the duty to warn. If it goes in detail saying that you search it and you are aware of your state board of nursing, usually then the answer will be duty to warn. Okay. Someone else has a question there. Please unmute yourself. I cannot hear you if you are talking. So let me read this question. In the routine follow-up session with the PMHNP, a patient informs the practitioner that her spouse has expressed a desire to end his life while at work. Right? So you receive this information. Now, the PMHNP first course of action should be what? So now you got to think before you even answer the question. And then the answers would be alarming the husband employer, right? The person is at work. Should I call the employer? Informing the husband relative, advising the patient to check on the husband, or contacting the local authorities to report the potential dangers. Remember, every state you can do that. So call the police and inform them. Okay, don't call the boss. Don't tell the family to check on the patient. Don't tell the spouse to go check on the patient. Here you have to call the authorities. You have a potential danger and applies to every state. If a patient has been involuntarily hospitalized, so immediately you got to think, okay, which of the case does it apply? And refuse to take his medication, now start narrowing down on the cases that you know. What course of action should be taken? The psychiatric patient in an involuntary status can refuse medication. Is that true, or cannot refuse medication? Is that true or false statement? He's involuntary. Can he refuse medication?
Involuntary or not, he can refuse the medication. Right to refuse,
Okay.
yes.
So he can. So that's this statement cannot is a false statement. So we can cross that out. Even if he's involuntary, he can refuse medication. Psychiatric patients do not understand what is best for them. So we know that's absolutely not an answer that we would look for. Psychiatric patients can refuse medication even in an involuntary status. We clear that up. We know that's true. Nurses must use sound clinical judgment and insist that the patient take his prescribed medication. Well, in the beginning, that's another way to know if the right answer. We're going to cover this in detail on our PMHNP crash course review. For answer to be true, every time it's connected by and, but, however, or other connections there, the whole phrase must be true. Here it goes. The nurse must use sound clinical judgment. That's an absolutely correct. And insist the patient to take his medication. So that's incorrect. For an answer to be correct, the entire answer choice must be correct. So that would be incorrect. So involuntary admitted patients can refuse medication even if in the involuntary status. So again, I want you guys to learn those cases early and do not get into detail. Just learn exactly what is said. You may read a little bit more about it, but don't get yourself in a rabbit hole of those details because it will not serve you well. Okay? You're not a lawyer, and the question should never be super detailed. Now let's talk about informed consent, which is different than confidentiality, right? So informed consent is a communication process between the provider and the patient that resulted in the patient acceptance or rejection of the treatment. Usually we see this a lot with the surgery, right? Informed consent. So it allows the patient to make an informed decision. It is the right of every adult or emancipated patient. Remember, patient has two rights: least restricted environment and informed consent. It's the right of every adult and emancipated minor, right? What does it mean? A minor is emancipated if the person is younger than 18, who is married, a parent, or self-sufficient and living away from the family household. Now, how is an informed consent should be given? How? Well, you have to talk about the nature of the treatment. What are the alternatives available? Can the patient receive SSRIs? But they can also get psychotherapy or even other alternatives types of medication. The benefit, you have to talk about what are the benefits of doing this treatment. You have to talk about risks. Yesterday I had a patient that says, well, you never talked about, I'm feeling great and my anxiety is gone. I actually feel the best I ever felt, but you never talked about uh, sexual side effect. I said, well, we did. Remember, actually, I documented, we talked about it, and here's how we are going to deal with this situation going forward as far as possible, minimizing the side effects, right? So always have to talk about the risk and provide opportunity for question. And that is a good informed consent, right? So when it comes to informed consent, we also have to I have a mnemonic called CARE. So you have to communicate the process between the provider and the patient. A is for acceptance, the results in the patient acceptance or rejection of the treatment. R for right of every adult or emancipated minor. And we talked about emancipated minors, the definition, what that means, right? Now, informed consent again, elements of it, in order for someone to provide informed consent, they have to be in the right mindset, right? They have to be sound. They have to be able to be competent, able to disclosure, able to understand, has to be voluntarily, and they must consent to the informed consent, okay, to the procedure. I consent that this will happen. Can they take it away any moment? Yes. If they are hallucinated, can they provide informed consent? No. Right? Just guidance here, right? I don't think you need to memorize it because it makes sense. So, patient's right. I said two, right? Earlier. But confidentiality, informed consent, and least restrictive environment. Earlier I said 3, and I kept saying 2, just so you now come to know that the patient has the right to confidentiality, but not privacy. What does it mean? Well, the right of confidentiality means that you have the right to have your treatment confidential. The right of privacy is different. Privacy meaning that you and I will talk in this room and will be private. However, that's not your right. It's something that I would love to give it to every patient. Should I do this if the patient's violent? Should I interview someone and put myself in dangers? No, I have to do that in an open door, in a way that I can escape and provide the most privacy possible. Okay? So when you say patient's right, confidentiality, not privacy, informed consent, least restrictive environment. I think I repeated about patient's right at least 6 times today. Very important. And also the caveat is privacy, that you will see questions on a board in regards to privacy. Yes, you would love to give it as much as possible, but never in a way that you or the patient will be in dangers. Okay? And remember, again, claim, case, refuse any treatment, right? So has the right to appeal to a treatment. So checking and learning, if a child is 7 years old, their medication order must be provided, approved by their parents. Which of the following elements of the informed consent does the child not meet in this case? So it starts with an age, and then it talks about informed consent, right? So what is the element for informed consent we should be looking out for? Now here's a not, it doesn't meet that. So does the child has autonomy versus veracity? Is the decision capacity and comprehension? Is this the confidentiality and beneficial case, or is this a disclosure of information and voluntariness? What do you guys think would be the answer here? Which of the elements the
Me,
child
I
does
said
not
that.
meet? All right, so some people said B. Okay, let's take a look. Decision and capacity comprehension, right? So the child of 7 years old doesn't have a decision to say, I would like to have breath implants, right? It doesn't have a full comprehension of the procedure. So the child in this case cannot give consent, right? I have seen some law cases in which doctors provided breath implants to a male and later got sued because I think it was like a 14 years old and authorized by the parents and so forth. Not saying they won the case, right? But anyways, so we have to be careful, right? It has to be competent and has to be comprehend of what's happening. So now as we move on to ethical principle, that's another topic that you will see on the board for sure. And that's one that's easy. And easy topics comes with hard questions. So what are the ethical principles, right? Justice is one of them. Justice doing what is right, fairness in all aspects of care, right? Regardless of sex, color, religions, or anything, you have to be the same for everyone. Non-maleficence. You see this all the time because it's a do no harm. Very simple, right? Well, not really. stopping a medication that's causing harmful side effects or discontinuing a treatment strategy that's ineffective may be harmful. That is non-maleficent. Example, trazodone could cause priapism, which is an erection, for extended period of time without any reasons for in males. Therefore, you may want to stop this medication if the side effect occurs. So here, how the board would present it to you, it would not say doing no harm. It would say 55 years old, John, male, started taking trazodone as a complement therapy for insomnia. At nighttime, he felt a erection out of the blue with no sexual activity. The erection lasted over 4 hours and he had to go to the ED. If you are the prescriber, which of the following ethical principle would this case most likely apply? It has nothing to do, or which of the following principle this case mostly apply if you decide to stop the trazodone. So very vague, right? And then you have to think non-maleficence is doing no harm. And that's when you connect. The question will not say duty to doing no harm. That's very simple. That's like 7 years old type of question, right? You have to apply this principle to the question. So if you stop it, let's simplify. If you stop in a medication to cause no harm, is non-maleficent. Is this only with the trazodone? No. Adderall, you stop in the medication due to the possible addiction, or patient has been addicted in the past, and therefore you are not prescribing Adderall. Benzos, you're taking away the benzos because you saw signs of addiction or abuse. That's non-maleficent. And that's what's important. It's not a definition, but how we apply to the question. Clear? Okay. Imminent dangers. If you feel imminent dangers, you stop the medication, means non-maleficence. How about beneficence? Well, when you give something to the patient that benefits him or her, that is beneficence. Example, SSRI for someone with depression. Okay, so the same principle put in the question. How would you recognize it? Fidelity is being faithful, loyal to you being a nurse, keeping your promise. So anything that has to do promise and keeping integrity is fidelity. Okay, example, meeting the patient reasonable expectation. The role of fidelity is here, such as being respectful, competent. If you are a competent PMHNP BC providing care, which of the following ethical principle would this most likely apply? Guys, this is hard, right? Question number 170. You are super tired after 3.5 hours. Didn't say anything about fidelity. The key here was competent. When you're being competent, it connects to fidelity. So pay attention. That's one that's very easy to miss because it's very easy to say, oh, I know what fidelity is. Okay. So veracity, telling the truth. Autonomy is the right to self-determination. Is another example that we get as a lot of incorrect answer, because here, when you say autonomy, a lot of people think, is this my autonomy or is the patient autonomy? It's always the patient autonomy. So, and the question will mix it up, make it sound like it's your referring to your autonomy, but in fact it's the patient's autonomy. So respect the patient's decisions to refuse life-sustaining treatment. Remember, the court ruled in the Rainey versus Kane case, an involuntary committed patient who has not been found incompetent, absent of emergency, obviously, has the right to refuse psychotropic medication. Respect, treating everyone with equal rights, right? So now, if we talked about these principles, and I am going to show you a slides, can you spot the ethical principle in nursing that's missing in this post here? So we talked about autonomy, beneficence, fidelity, justice, maleficence, and veracity. Which one is missing?
Respect.
Respect, right? So I really urge you to pay attention to the details on that slide and be able to be like, okay, if it talks about this, maleficence. If it talks about this, beneficence. If it's fidelity, what are the examples of fidelity? Okay, justice. What are the examples of justice? Mnemonic, JNBF, fair, or January favor, right? Way to remember that. I would say justice, right? Fairness in all aspects. Maleficence, doing no harm. Beneficence, promoting well-being. Fidelity, just a caveat to maleficence, taking away something because it could cause harm, right? Fidelity, competence, faithful, keeping the promise, true and loyal. Autonomy, always the patient's autonomous to decide what's right for them. Respect, treating everyone equal. So justice often get mixed with respect, right? Because it's fair, being fair is being right, but so is treating everyone with equal rights. So be careful of justice and the respect. The questions can be very close. So if a patient with anxiety disorder and a history of drug abuse requests Xanax, there are ethical principles to consider before denying this prescription. What is the ethical principle used to deny this principle this patient access to Xanax? Would that be beneficence because you're benefiting the patient for denying? See how your mind can trick, right? Can trick you into picking a answer. It can be justice. I'm denying this patient because it's justifiable. Maleficence. I'm denying this patient because doing no harm. Or veracity. I'm denying the Xanax because it's true that I don't know, he had the drug abuse history. So be careful. We know that we're denying the medication based on the principle of non-maleficence, doing no harm. So therefore, I'm not going to prescribe you Xanax due to this history. Okay? Are we very, very clear?
Clear.
Clear. All right. So when the PMHNP prescribes Zoloft to a patient with major depressive disorder, which ethical principle is most likely to be utilized? Veracity, autonomy, justice, beneficence. What you guys think?
Beneficence.
Okay, anybody disagree? Please say it if you do. Because it's important that we get it right here. So we can, it's important that we clarify here so we get it right on the test. Right? Then we'll move on. Beneficence, right? When you're doing something good for the patient's beneficence. If a patient is excluded from a treatment by a PMHNP for financial reasons, which ethical principle is violated in this situation? A, beneficence. B, maleficence. C, justice. Or D, veracity.
See.
C.
See,
C.
Anybody disagree? Okay. Guys, this is the time to get it wrong. I promise you. Okay? The more you participate and the more you get it wrong now would benefit you highly on the test date. So I'm so sorry. Senzani Healthcare Service. Do you have a question there? I couldn't see you lift your hand. I was on another screen. Nope. Okay.
No, sir. Thank you.
All right. So I do apologize. I was using another screen that couldn't see your hand. So research, PICO, right? Questions and level of evidence. I guarantee you will be on your test, right? Anything that you see, you learn this in nursing, and you learn it again and talked about on your master's or doctor's degree. I promise you, ethical principles, you saw that. PICO questions, you saw that in your nursing school, will be on your test again. So let's start by saying that you need to know PICO T in details what it means. So as you need to know cage in detail by the meaning of the word, because you're like, oh, I kind of know what cage is, but they'll mix and match letters. They'll make it very confusing to you. So at least 3 things you need to know. It's PICO, cage, and the third one we're going to follow up later on today. So PICO, P is used, it's for patient or population. I, it's for the intervention given. Then we're going to comparing the C. A is a placebo. B is the medication. Then we look what happens for the O, outcome over a period of time. Memorize, know what each letter of PICO means. Because if you just think, okay, I is involuntary treatment versus voluntary treatment, I for inconsistent of a treatment, I for intervention, or I for, I don't know, something else, right? It makes it difficult when you already know what it means. The test makers cannot confuse you. Okay. So PICO. Then this is the pyramid of what evidence-based it's all about. Guess what? It's the least important on this pyramid is the expert opinion. Oh, so you're saying the cardiology that's been doing this for 30 years, he recommended this. Is this the highest recommendation I can find? No. I do respect and understand his recommendation. By comparing his recommendation versus the systemic review or meta-analysis, one or the other is the top of the pyramid. Okay, so don't go for the cardiologist, #1 in the US, 30 years of experience. Even though that sounds super strong.
Doctor, excuse me, I'm confused with this because is this supposed to be, is this pyramid supposed to be for quantitative or qualitative? Because that's where some of the questions I'm seeing, that's where I get it wrong. So this pyramid, is it for quantitative or qualitative?
Well, it depends. I wouldn't answer one or the other, right?
Okay.
Because it falls in between both. Usually, quantitative would be the answer. But is that always right? It depends on the research. So I would put this pyramid in between both of them. But more important, you want a systematic or meta-analysis research to base your evidence practice. And if that's not available, you move to the next, which is a randomized controlled trial. If that's not available, you look at the cohort studies. And that's when you start looking more in qualitative studies. It could be. Now you look under that for case controls. Now you look at case series, more towards the qualitative studies, right? And then case reports. Like I had to do a case report on Blue Lotus here in my region because I've seen a lot of soldiers being admitted for psychiatric conditions, and I couldn't find the reasons. So I had to do like all kinds of labs, send back to the States, and I find out that there's a Blue Lotus issues going on where I live now, right? So I've been admitting these patients that never had any psychiatric conditions, and I find out that there's a Blue Lotus, right? So now I can write a case report of the incidents, right? Or do an editorial opinion or expert opinions, right? So now when we look at PICO questions and level of evidence, we want to always go for systemic or systematic reviews or meta-analysis, right? That's like I get all the RTCs, I put together, punch some numbers, and get a finalized answer. If that's not available, I use the evidence base from at least one well-designed RTC. If that's not available, I can use the cohort study, which follows a group over time. So we started the treatment here, and we're going to follow up over time to see how a factor affects the outcome. But you can see how many factors can affect the outcome, whether I eat meat or not, whether I drink alcohol, smoke, or so forth. Case control is a type of observational study. Now we get into qualitative studies. That's why I said the pyramid, it falls in between, where research is analyzed two groups of people, case and the control, to look factors associated with particular disease or outcome. So hopefully now it answers your question more precisely. Okay, if you lose a case control, it's more towards qualitative studies because not every study has RTC, not possible. Cases report, an article that describes interpreting an individual case is often written as a detailed story of what happened. Remember the cases of Blue Lotus. Expert opinion in the field, right? So a practitioner should always follow evidence-based guidelines and consider the patient's goal, including ethnicity and culture. A critical factor for us in educating the patient and community about mental health, effective management of mental health condition. So remember that culture response to a stress, cultural response to a stress is an expected response to a stress, does not mean a mental health condition. If I just saw someone being shot and I came over here frantic, oh my God, screaming, that does not mean I have a mental health condition. If I sleep, let's say I'm from Brazil, and in my culture, we get up at 2 in the morning for a run. This is totally made up here, right? That's not normal to the practitioner, but if it's normal to my culture, that is not a mental health condition, okay? So we're talking more about culture in just a little bit. So look for cultural answers when dealing with a cultural question. How do you know this is a cultural question? I would say he is 25 years old, from Brazil, speaks Portuguese, lived his entire life in Brazil, you know, something along those lines that would emphasize he's from Africa, or Japan, or any other country. That would be a cultural question, and that requires a cultural answer. So education is essential. So if you think about picking a mode to target the most possible people would be a radio versus a class. So if you see, how would you educate most people about suicide? Especially when that question starts one way. Let's say there was an incident in the high school. You have to pay attention because this is very, very critical. Happens in almost, not a, I would say 30% of the questions will come this way. It will talk about a subject and switch. How? It's called the bait and switch. 15 years old, John died of suicide while at home. The school is in shock. The students are asking for answers. Which of the following would be the most appropriate to educate the community about suicide? So it did a case about high school students and how the students were affected. And now a switch. It's called the bait and switch. So I start on one way and I switch the question. So the core of the question is about community, right? Although it made sound that it was about the high school case. In this case, you have to educate the community in a way that you can reach most people. And I guarantee you, in a question like that, A would have been provide health service to the teenagers at school, right? Because I'm counting that you will be stuck on the first part of the question. And when I switch, what I was asking for. So be careful, okay? Most of the time, it's not a lack of knowledge, but a lack of how to answer those questions, okay? So always ask the patient to interpret the meaning of their culture. What does it mean to run at 2 o'clock in the morning? Is that normal? Can you educate me? That would be a possible answer for the guy that was running 2 o'clock in the morning, right? So, for example, mal de ojo, right, is a Spanish phrase that often translated to evil eyes, right? If somebody says, hey, I believe this is an evil eye condition, you respect that. You don't say, no, I don't believe it. This is not true. Mal de ojo, okay? So as we move on, what are the initial action? When you hear initial action, you always think priorities. When you think of priorities, you have to think of three things. Airway, breathing, circulation? No. Maslow hierarchy of need? No. Then the third is the nursing process. So what are the initial action? What should I do immediately? Should take to improve substance abuse program based on EBP? Okay. So does it involve airway, breathing, circulation? No. Does it involve Maslow hierarchy of need? No. So now the third one is the nursing process. When we do the nursing process, what do we do first? We will assess. Assessment for nursings at our level is different than assessment at the RN level. When we say assessment, we mean collection of data, research, vitals and assessment, labs and assessment. So we're looking for an assessment. Do we want to implement the use of a valid instrument for this question to improve a substance abuse program on EBP? Do we want to improve the outcome through analysis and synthesis of the evidence? Do we want to maximize the intervention and increase the skills utilizations? Or do we want to optimize a revenue generating potential? What would be the right answer here?
B.
B, why?
Well, it would improve the outcomes for the community
Okay.
through the research.
So, all right. So you saw this is a research question, right? So optimize revenue doesn't have to do anything with research. implement use of a valid instrument. That's not what the question is asking, right? And maximize intervention and increases skills utilization is not what the question answer here, right? So here we have improved outcome through analysis, synthesis of the evidence. So if you go back here, you were stuck. You had no idea what the answer would be. Look at the title. Look at the stem of the question. It has EBP. Which of the following answers would have similar evidence of EBP? So that would lead you to synthesis of evidence, right? So if you feel that if you're getting stuck and you do not know the subject, look at the stem of the question and then look at the answers. Sometimes the answers will be in a similar word or synonymous of something that's on the question. Only use this strategy when you don't know, when you feel stuck and you have to pick an answer and you don't know where to go. Okay? So if a PMHNP becomes aware that her colleagues are using off-label medication to treat psychiatric condition, what initial steps should take before criticizing her colleague? What do you need to do? Report her colleague to the nursing state board, contact the pharmaceutical manufacturers for more details. C, understanding that her colleague have many years of experience and is entirely safe to prescribe off-label medication. Or D, conduct a literature search to determine whether the data support this practice. What you guys think would be the answer here?
I took D.
D.
D? Okay, perfect, right? So remember, reporting colleagues to the nursing state board, it's always, not always, usually the incorrect answer. Contacting the pharmaceutical company, manufacturer for more details, they could potentially mislead you, right? Yeah, go ahead, use my drug. It's the most effective. I think you have the best outcome here, right? You probably don't want to do that. Understand that her colleague have many years of experience and is entirely safe to prescribe off-label medication. Not a good answer, right? We want to base our evidence on research. Always higher level of research, preferably, right? And we'll go down in the pyramid if we don't have the evidence available. So a group of PMHNP is collaborating on a safety round project. What is the recommended evidence-based approach to kickstart or initiate this project? A, you want to conduct a time study. B, identify community standards. C, perform a literature search. D, survey the nursing staff. Okay, what do you think is the answer?
C.
All right, so I'm on purpose. I love that someone said two different answers here. Why you think is C? If you said C?
Because research, it's an evidence-based project for, so
Okay.
you do a literature search.
Perfect. And D, D sounds pretty good too. Who said D? Somebody said D, right? Or no?
I didn't say, but I just felt that the reason why D is a bit good is that before you start, the population do know exactly what to do. You have to survey and make a survey of the nursing staff to identify a problem before you start the research. That's
Yeah.
why I did the study.
Yeah. So these are two good answers, very good answers, right? And they can be actually very close related.
Yeah, but
So, but let's look at the question. A group of PMHNPs collaborating on a safety round project. So there is a project for safety round. So very close related, right? But what would be the most effective way to collaborate, right? So I can see why would you go for survey the nursing, because you need to know what's the problem. But if you want to collaborate based, and then the second part, based on evidence-based approach to start this project.
Yeah, the
That
evidence
is the,
made it that you
yeah,
have to, yes, it's a literature because of the evidence base, it's
exactly.
already, yes, so you have to make a literature research.
Okay. So be careful. Sometimes it's not what you know, but how you answer the question. So evidence on the strength hierarchy, which option is the strongest regarding evidence-based practice? Is a meta-analysis, cohort studies, expert opinion, case control.
An analysis.
All right, meta-analysis, okay? So you need to know that meta-analysis and systemic review, they are close related. They're not the same thing, but they are the two strongest evidence-based practice. So, all right. We are
Another
almost
question, Doctor, there's another question I used to see on this research that
okay.
others may know. They talk about p-value and
Oh, okay.
t-value,
Yeah.
ANOVA.
So, yeah, that's we're getting a little bit more in the weeds, but it's although it's a valid question. I have some materials on that, but I think it's maybe how I would say. I think it's important for you to know as you going to practice. You need to know what's the p-value, ANOVA, and
Yes,
all that.
yeah,
But
because I saw a
I
lot of
wouldn't say
people.
that's super high use. Okay. I would say that's important to know, kind of, because as a nurse practitioner, you really want to be looking for the p-value, the probability of this happening by chance, right? Well, and you want that to be less than 0.05. Well, the probability of this happen, so the lower p-value is the best. But at the same time, do I think this is high yield? No. Should I know? Probably yes. But I wouldn't think that's high yield, super high yield, right? But remember, if we are going to cover the course in itself is already pretty big. If we are going to cover every single detail about herbs, about research, we may spend a half a year here, right? So I hopefully they answer your question. And I have some material on the side that I can always put out and give it to you if you want to know more detail. But I don't think I put in a course specifically because it's not super high yield. Okay.
Okay.
So now, if these things are high yield here, hospital policy, patient advocacy, and just justice, culture of care. So here, health policy. Before you do a health policy, there are phases. So you have to formulate, implement, and evaluate. Phases, formulate, implement, and evaluate. Then you have to do a reform, which is a change in the program or practice. The environment is where it occurs. The policymakers are key players and stakeholders who are involved and who are the stakeholders in this process. So when you got a question, this is very, very important. When you have a question about health policy, always assess the organization barriers and facilitate it before meeting the stakeholders. So the order in which you conduct health policy matters. First, what is the first thing you do? Is it contact the stakeholders? No,
No.
no, no. You address organization barriers. Find out who are the facilitators before meeting with the stakeholders. Then you assess and address organization barriers and facilitate it to EBP, right? Evidence-based project. First, You assess the baseline knowledge, beliefs, and practice using a survey. Very important. I would triple highlight this because it's very vague, but it's very important information. Okay? And we'll see in a question how this information can apply. So NP wants to implement a policy in nursing, starting with the nursing manager. So always start at your lowest level. You don't want to go to the CEO of the hospital without talking to your manager first. That would be a disaster, possible, right? So you contact your nursing manager first, and you feedback from staff after creating the policy to ensure it is actually doing what it's supposed to do. Use a survey to gauge, to see the learning needs of the staff before designing a education program or policy, right? But if you're going to design, you got to design based on evidence base, but you want to conduct a survey for education, okay? So online forum and survey can be an effective method to gather information from providers hard to reach areas. So if I'm a provider here in South Korea, where currently I am, and I need to talk to someone in Oklahoma, we can do this online, or we can do this through a forum, just like we have our student forum in a course, right? Can communicate that way and collect information. So all this is important information, and I would know by details before you take your test. Okay, so mnemonic, we can use the pre or prep, FII, FIE.
Policy making, physical policy reform, government.
You got a hot mic there, man. So it's policy making. What are the phases of policy making? The R for reform, where the program is take place. The environment is, where the environment is where the policy making takes place. The reform, change in the program or practice. The policymakers, players, and stakeholders. Remember, who we do first, right? Formulation, first phase of policy making. The second one is the implementation. The third one is the evaluation. Okay, so as you go through the course, if something's not clear, ask or read a little bit more about it, and then put in a forum so I can answer the question to you as soon as possible. In nurse advocacy, here it's about advocacy, patient advocacy. Ensure the patient's autonomy and self-determination are respected. So when you are advocating for the patient, you do so by respecting the patient's autonomy and self-determination, right? The right to stop, continue, take it back, treatment. So you do that for a reduction of the stigma in mental health illness. So anytime you hear advocacy, you think of reduction of stigma in mental health. So anything that you do to reduce the stigma of mental health, you are advocating for the patient. Anything. Okay? And that can be through education is another one. So stigma and education is the advocacy process for mental health. And you do this to reduce the shame of mental health. So it may not be super clear now, but hopefully you put those thoughts in blocks. You're advocating for the patient. How? Education and reduction of stigma in mental health to reduce the shame related to mental health. Help clients receive available service is a way to advocate for mental health or advocacy. Your role in advocating for mental health. So advocating promotes mental health by joining. Remember, how do we do that? We do that by getting ourselves into an organization, because we are much more powerful together than one person. And which organization can be any? Can be ANA. It can be the American Psychiatric Nurse Association, PAPNA, right? So basically, you are reaching a broader audience when advocating for the mental health concerns and reduction of stigma, professional presentations, TV programs. Someone has a hot mic there, please.
Let it
Uh,
be. You understand? I've decided to move on. You understand? But for now, just watch.
Betty, your mic is hot.
yeah, I clear. Thank you. So, how do you reach a broader audience? You do that by going to the TV, to the radio, right? Remember the switch, bait and switch question that we talked about, someone dying in the high school, but then asks about community. Perfect example. So spend some time on the slide, okay, to fully understand. Now, what is just culture, right? If you think about just culture, is a culture that seeks an environment that's encourage individuals to report mistakes to improve the system, not necessarily to get the nurse in trouble, right? When you hear just culture, individuals are continually learning, design a safety system, managing the behavior. So we saw a problem, we looked at a root analysis of the problem, then we make change. That's part of just culture. Holds people accountable for behaviors and investigate errors. Okay, just want to put this out there. So I just read the article yesterday of an ED nurse. Uh, she was taking care of a critical patient. And while she was taking care of a critical patient, she went to ICU to deliver another patient. In this meanwhile, she asked the nurse manager to watch out for her patient. The patient decompensated and needed to go to surgery immediately. So then the patient sued the nurse, and the settlement was like $500,000. And the reason they won was because the nurse could not recall a handoff from one nurse to another, right? So when they look at cases like that, it's just culture. Just culture means we have to hand off between one nurse to another. We cannot just say, hey, I got to take this patient to the ICU. Can you watch out for my patient? Right? So that actually the patient won this case because there was no handoff provided. Right? So just be careful. Just culture are continuously learning, design safety systems, and managing environment. So if I see a case like this, then I would do a timeout and say, hey, everyone, you cannot leave unless if it's emergency, automatically emergency, you cannot leave the ER without giving a proper report, right? So that is part of just culture. So hold people accountable for their behavior and investigate errors. So just culture is supported by whom? ANA is a position statement that is opposite of blame or punitive behaviors. It kind of tries to address the issues with vulnerability of the system that led to engage in an unsafe behavior while increasing the individual accountability by establishing zero tolerance for reckless behavior. So basically here, let's go back to the ER case. Was it reckless? I would say no. She had a mission and a purpose to deliver the patient in ICU. Okay, it wasn't reckless. She just didn't go outside, smoke a cigarette, and left the patient in a ER, right? So, but it was a system error that did not enforce the warm handoff unless a super critical must leave right now situation, right? So I believe this is a system error. And I believe that the hospital been doing this, all the nurses, not just that one nurses. This is how I would look at it, just culture case. You know, now if it was only this nurse and only this nurse always does this type of thing, then it would be a behavior of the specifically nurse. But I truly believe this is something that almost all ER nurses would do at least once in a while, right? Oh, I just gotta pick up something here and I'll be right back in 2 minutes. Can you watch out for my patient, right? And then the patient decompensated. So when we say just culture, we want to distinguish between human error and slips versus behavior or taking shortcut or reckless behaviors, right? If somebody comes to the ED and they just say, well, I'll see the patient tomorrow, admits the patient, and they did no assessment that something happened, I may be liable for reckless behavior because I didn't put eyes on the patient, didn't assess the patient, and so forth, right? Collaborating amongst nursing boards and professional organizations, patient safety centers to create a just culture initiative. So what is the goal? Is to create an open and fair learning environment designed for safety system and managed choices. The goal is to improve the system, not necessarily to punish the individual. So if you hear on the question, a just culture, it will say specifically that because that's the name. It aims in providing patient care in a culturally, continuing, improving, and designing safety system. That's the goal. To decrease system errors and manage behavior choices. So if it says that, hey, you want to punish this nurse if she's been reckless and X, Y, and Z, most likely it's not just culture. Now, does it mean the person will be unpunished at all? No, right? But it's all about systems. Focus on what went wrong, not who is the person. Again, if the person is continually doing the same mistake and there's only the person, then maybe a behavior related to that person. A PMHNP is tasked as a consultant to a psychiatric nurse facility to provide staff development assistance. After meeting with the management, what is the following action? Create an interdisciplinary management group, develop an outcome measure, market the education plan, utilize a survey to assess the educational needs of the staff. So here we provided, we were consulted for staff development assistance. So we would look for an answer that has educational to the staff, right? So what do you think would that be?
D.
D, right? So oftentimes you can match what the question is asking to the answer by looking for synonymous or similar words if you do not know how to answer the question. If you're lacking of clarity, that's one of the strategies that we teach under our next module, which is the PMHNP Crash Course Review. So before implementing a EBP project, what is the PMHNP initial action? So you already did, before implementing an EBP project, what do you need to do? You want to brainstorm with stakeholders and draft a detailed problem list. You want to compare data with internal and external benchmarks and coordinate ongoing education. Do you want to facilitate a collaborative multidisciplinary group to synthesize and compare the key themes, or you want to identify potential barriers and facilitators that promotes the patient's values and expectations? So A, B, and C, not necessarily the answer. D, identify barriers and facilitate it, as we highlighted earlier, to promote patients' values and expectations, right? Right. So there is a bill proposed in the Senate to allocate funds for the persistently ill, mental ill individuals in the population. The PMHNP has requested several supporters to contact their representative and support the bill. What is the role of PMHNP playing in this situation? Is he or she providing A, care provider, advocate, C, policy maker, or D, stigma reduction agent? Who thinks is A? Who thinks is B?
B.
D. Okay. Who thinks is C? Nobody thinks it's C? Okay. Who thinks it's D? Okay. All right. So, this looks pretty strong, but why would that not be D, right? So remember we said policy, advocacy, this is a policy. Well, not the same thing here, right? So let's take a look here. The answer is advocate. When you're advocating, you're promoting laws and systems to decrease the stigma of mental health, right? That's one way of advocating. So the PMHNP is worried about the accessibility of care and desire to implement a more streamlined approach to aid those in need. Can you suggest an effective strategy for creating an advocacy policy? So what we remember about advocacy policy, discussing with the clinic manage options for access to care. B, organize a political protest. C, working with a local chapter of nursing professional association. Or D, writing to the editor of a local newspaper. What would be the right answer? Anyone care to guess? Even if it's wrong.
C.
All right.
C. I take C.
C. Okay. Thank you. Anybody else? Okay. So you want an effective strategy for creating a advocacy policy, right? So you want to implement a more streamlined approach to answer or to aid those in need. So let's take a look here on the answer. Yeah, working with your local chapter of nursing professional organization. It's like you are new to this. Who would you go to? Well, go to the people that are working together for many, many years to help you solve a possible problem. Okay. Let's go ahead. Let's see. This is let's go ahead and take a pause here and then we'll come back, and we got only two. We got only two more left. Let's take a 10 minutes pause. So it's 8 minutes pause. Well, let's do it. You guys want a 10 or 15? Anybody cares for 10 or 15 minutes break?
10 is good.
10? Okay.
Okay.
So, all right. So we'll be back at 8:25 p.m. Eastern Standard Time. So 10 minutes from now, just stretch, get a cup of coffee if you may, if you want to. We'll be back shortly, okay? 10 minutes.
You say we're gonna return this one, or you take it to warranty?
Yeah, we need to. Dylan, I'm not done yet. You're not gonna sit there and ask me 9 million questions. No, I told you we're just on break.
Yeah. Let me know.
So we are almost done with number 7, and we have just few more to go. One more minute and we'll get started.
Oh my God.
All right. Any volunteer want to help me out here and read the question?
I'll read it.
Thank you.
A psychiatric mental health nurse practitioner, PMHNP, is heading an interdisciplinary team formulating a treatment plan for patients with schizophrenia. However, during the second meeting, the nurse manager resisted the idea and was pessimistic about its implementation. The project's success relies on the manager's support. So the PMHNP must strategize the best response. What should the PMHNP do?
Want to read the answers, possible answers there?
Yes. A, meet individually with the nurse manager to discuss the perceived resistance.
Mm-hmm.
B, report the situation to the nursing director and ask for administrative inversions.
Good.
C, revisit the initial goals of the group at the next meeting and ask for comments. Or D,
Okay.
schedule another meeting of the group and move through the agenda since the majority of the group is supportive. Can I answer the question?
Yes, please.
I think meeting individually with the nurse manager, because of the hierarchy, you want to go to the person first.
Excellent. Excellent. Right. I mean, we can go about in real life in many ways, but it's always good to work with the person that's directly above you, right? So it's never a good idea to skip the chain. Now, in life, sometimes our projects are stopped because of X, Y, and Z. And if you tried everything and you really want to push it, then maybe acceptable. And sometimes if you are working with someone that simply don't like your ideas, don't want to implement, you may have to wait for the person to move or find another location where you feel valued, right? But always go with the next above person, discuss the concerns, try to understand their point of views. usually that's the best way to go about. Okay, thank you for reading. I'll read this one. How can we address barriers of patients from a certain cultures refusing to acknowledge a diagnosis of mental health disorder due to feeling of shame? Educating the family. B, political advocacy. C, public health concerns. Or D, community education programs.
I think I would take community education program.
Okay, now the same question. 55 years old African, moved to the States a year ago. He does not believe about mental health. How can we educate the community about mental health? A, educating the family. B, political advocacy. C, public health concerns. Or D, community education programs. What would be the answer?
Educate the family.
I would still
Okay.
go with community, because you said in the question is how would we educate the community, even though your distractor in the beginning was that the person or whatever didn't believe in mental
Right.
health. But that was the stem of the question, still asked about community.
Community, right? So that's the bait and switch, right? So I start with the case and I slightly switch to another question, right? So be careful. Be careful those questions. We make a lot of tests. I make a lot of tests for educational institution, and that's one of my number one go-to way, right? So be careful, because I start with a patient or a situation and I switch at the end of the question. Okay, so that's something that you will see on your tests.
Okay.
So it will be a community program. Thanks for collaborating, okay? So during a telehealth evaluation of a new adult patient, a PMHNP addressed queries regarding a new medication. What could be a potent method to promote a psycho education? So A, answer questions related to the medications and email the information and resources. B, highly encourage the patient to seek information on the internet. C, have a phone conference involving the family members. Or D, refer the patient to a primary care provider.
A.
A, okay. Anybody disagree? No one disagree? Oh, it's slightly disagree? Okay. All right, so A it is. That is the right answer, right? Answer the related questions to the related to medication, email the information and resources. So that's okay to email information and resources, right? Remember, if we're doing medical records, encrypted 2 ways would be the preferable. It can be one of the possible ways to communicate, right? Now, someone can read this question, possibly? Any volunteers?
A psychiatric mental health nurse practitioner is employed in a hospital where she has witnessed the attending physician mistreating the nursing staff and neglecting to answer their phone calls. The PMHNP is concerned about the quality of care and wishes to minimize errors in the unit. What action should the PMHNP take? A, contact the nurse manager and report the attending as bullying. B, report the case to the Nursing State Board of Nursing. C, report the case as a civil disobedience. D, report the finding that contradicts the just culture of care.
What would you think would be the most appropriate answer?
Let's see. I would say D.
Perfect. If you look at the question immediately without looking at the answer, what I say is, what's this question about? What are we talking about here? What kind of cases? What does it
It's
in
talking
general?
about just culture.
Just culture.
Mm.
Then we look at boom, there is a just culture answer there. So practice answering the question without seeing an answer. Okay, and most likely you are able to get the correct answer and match it, and then that way you don't have the distractions of, oh, I would go here or I would go there, because your mind can trick you in picking the incorrect answer, right? So we just finished just culture, so we are going to the next module, which is next training, which is training number 8 and 9, and we'll be done for today. So one quick second, I'll be after the training, I'll be available to answer questions about the program or any questions that you may need some assistance. So one quick second, please. So now we'll be talking about quality improvement and reflective practice. Especially quality improvement is something that you need to be acutely aware, because as nurse practitioners, you will see quality improvement, right? So what is quality improvement and reflective practice? So more precisely, what's quality improvement? When you say quality improvement, think of projects designed to improve the system, decrease costs, and improve productivity. So that's like any business, you want a quality improvement. Why? Improve the system, you want to decrease costs, and improve productivity, right? Generally speaking, quality improvement does these 3 things. For example, here in patient care, how do you do a quality improvement? So I would right now write down quality improvement equals retrospective chart review. Quality improvement equals retrospective chart review. So we are going to look back in the past in the charts review to seek the outcome that we want. An example of quality improvement would be retrospective chart review. So if we look at quality improvement in itself, we see, quality control, quality assurance, quality improvement, and management, right? So all that is part of a quality, improving quality in healthcare that leads to the outcome. So not that important, but just a process. So if we look at quality improvement to achieve the 3 things that I've described, we want to do this through a PDSA, not ASPD, not SDPA, matters the order. Remember when I said there are 3 things at least that you need to know what they mean by the acronym. There are more than 3. I said CAGE, you need to know CAGE in details, what CAGE means, each of the letters. You need to know PICO in detail, each of the letters, and you need to know what PDSA is. And PDSA, it must be in order. The order matters. So what's a PDSA? The plan, do, study, and act. Is the 4 steps cycle that implements change, solve problems, and improve the process. So quality improvement equals retrospective chart review, which is equals PDSA. So the scientific model of improving institutions of healthcare improvement, PDSA. So from now on, you hear quality improvement, automatically 2 things come to your mind, which is retrospective chart review, PDSA. And you got to remember what PDSA is. And you got to know that is in order, because it could easily put a question of quality improvement and ask what the P stands for: problem solving, patient, prevention of disease, mental health, or something else. I'm just making up things to show you the value of knowing that the P actually means plan. The do is doing it, the S is the study, and the A is the act. Okay, for quality improvement in um, in hospitals or in care settings, right? So what does it look like? Well, you want to plan the change. You want to do what? Carry out the plan. And then you want to do the study to examine the results. And you want to do the act, decide what actual improvements will improve the process. So let's take a look at this in practice. Oh, so sorry. Sorry, guys. Did I? Sorry, I got kicked out of my own thing. So let's look at this in practice. So you should only start with P for the plan. Let's see, in this example here, you want to enlist environment service team to join the change. This is about cleaning, right? So you want to identify the process of cleaning rooms, establish how custodians are notified that the rooms needs to be cleaned. So that's the plan. You move to the do. So the do here is change from a centralized cleaning phone number to a mobile paging system. So we're no longer calling, but we're paging. When a room needs cleaning, X, Y, and Z room. So you want to train the custodians and clerical staff on how to use the new system. Now we're going to the study. See, we're going to evaluate. So we want to measure the average time it takes to the cleaners to be notified that a room needs cleaning. And you want to compare to what you were predicted. You have to predict the outcome, right? And then you want to see if it analyzes results with changes, right? And then you want to act. Here, based on the key learning, you do a plan. You plan your next PDST cycle. So it's a revolving cycle. We did the first iterations, we got the results, and now we're going to do the second one with improvements. Then you found that change the pagers decrease the time of notification, but the system is needed to decide which custodian will be deployed to the ED. You proceed with the planning phase again. So now you did the first iteration, plan, do, study, act. Now you implement with new changes and you try it out again. So that is processing quality improvement equals retrospective chart, which equals plan, do, study, act. A way to synthesize it in a manageable way so you ace your PMHNP board certification when it comes to this subject. Okay, so now moving on to a different topic. It is called reflective practice. What is reflective practice? It links theory to practice, right? So it's what we learn and how we apply now. So if you do reflective practice, you put equals to debriefing strategies. Reflective practice equal to debriefing. So it provides the feedback in a debriefing strategy. So, for example, learning from experience. Through reflecting, you can bridge the gap between theory and practice by analyzing situation, understanding the actions, growing, and learning from them. So for test purpose, I want you to always remember debriefing. Reflective practice means debriefing. Debriefing strategy, debriefing what happened, analyzing, thinking of the situation. So reflective practice means debriefing. Okay. Please go ahead, just mute yourself and ask the question. I cannot hear you. It might be muted.
I'm okay, Dr. Lopez. Sorry.
Okay. All right. So I cannot see because I'm in a different screen. I just heard a click.
Dr. Lopez?
Yes.
I have a question regarding the improvement, quality improvement.
Mm-hmm.
In test purposes, regarding test purposes, will there ever be both PDSA and choosing the retrospective chart review? How can we?
It could, because one thing, they both related to each other, but it's like, how would you identify the problem? By doing a chart review. How would you solve the problem? By implementing PDSA, right? So yeah, it could, but it will not be, most likely will not be in the same question, right? Because one thing is like identifying the patient that was a problem with AD. Let's say the patient taking a long time from arriving to the new station in whatever the patient is going. So that, how would you know that? Well, you have to look at the patient chart. In that problem, then you do after that PDSD. Now, not necessarily room cleaning, you would look at the retrospective charting, right? Because most nurses, I have never done, say, hey, the room needed 15 minutes, took 50 minutes to be clean. That's something that doesn't belong to the chart. And personally, I don't believe it should ever be in the chart, right? So it wouldn't be applicable to that. Okay.
Understood. Yes.
Yeah. Anyone kindly could help me out and save my voice here and help me with this question?
I'll read
A
it.
retrospective,
Go ahead.
a retrospective audit is part of a quality assurance program that includes A, examination of the chart discharge and using specific criteria to determine the quality of patient care. B, inspecting the facility to monitor the therapeutic quality of the environment and to suggest improvement. C, reviewing patient charts to determine how appropriately the hospital resources are being used. D, using a case conference format for staff to discuss ways to improve particular patient care. Let's see, I would say A on that.
I would say A.
All right. C is very confusing too, right?
Yeah, but it's saying hospital resources are being used.
Okay.
I know that quality improvement, cost effectiveness is included, but
Lala, get out of there.
I just wanted, and because of this word, to determine why I took A, to determine the quality of patient care. That made me to say this A. But when you look at C is similar, but it's saying appropriately the hospital resources are being used. It's not all about resources, it's about patient-centered.
Yes, I could not love your answer any more than what you said. So great job. I think you were right on it. Although it's similar and although it's tricky because quality improvement means the reduction of cost, it doesn't trump. It's not the best answer. So we always have to look out that almost every answer will have the right answer and then next to it. But which one of those yield the most for the patient? Okay. And almost never it's about cost when it comes to to the board. A responsible could the other person that was reading the other question read this one if you can kindly?
As the responsible party for quality improvement in a clinic, what would be an effective way for the PM to evaluate patient services? A chart review analysis. B, a root cause analysis, C, a plan, do, study, act, D, failure effect mode analysis.
See.
Okay.
What do you think? See? Oh,
I would say, let's see.
okay. So when we have
Evaluate effective way. I mean, it's a tricky
Yeah,
one though.
because quality improvement is all about PDSA.
PDSA, yeah. Okay.
would you agree with that answer?
Yeah, that is true.
Okay.
You kind of plan what you're
Yeah.
going to do, and then you
Right.
kind of study it, as to how you're going to implement it, and then you act on it.
So this is a perfect question of content that we just reviewed, put in a hard question. Now think about 30 days from now, you are sitting down on the board and you get this question 175, 150, 170, close to that. It becomes very, very difficult to do a plain study, do act as the answer because you're tired and then you have like exhausted, right? So this is the principle of starting every day will pay off because it ingrains in your brain and prevents you from picking the wrong answer. Because quite frankly, a chart review analysis looks pretty good.
Yeah, because he's talking about evaluation. So
Right.
this one looks good. But
yeah,
the thing is that for quality improvement in a clinic.
Perfect. Okay. And also oftentimes when you hear like things that you haven't heard of, like failure effect mode analysis, and most of the time is the wrong answer. Why do we put it? Because we know that when we put things that people don't know of, they tend to pick that, right? As making tasks, that's one of the things that we kind of like taught. Hey, put something that they don't know what it is, most likely, and because they don't know what's the answer, they might pick one that they never heard of, right? So these are distractions, right? Plan, do, study, act. How would you know? Well, it says quality improvement, right? So
I have a question though.
Please.
Yeah, I was wondering also the other, like the root cause analysis.
Perfect.
Would they have to find that there was an issue or something before you choose that one, a specific issue?
Yes.
And that's my question also.
Perfect question. And I'll tell you right now, it was an excellent question. Why? Guys, when you participate and whatever's in your mind, I need you to take it out. Because as we clear those issues, it'll become a little bit easier. So I want you to ask a question. I want to be there for you. When you say quality analysis, I mean root case analysis, first thing that comes to mind is somebody died or was a serious issue, right?
Sentinel issues.
But it's not the right answer because it can be a root cause analysis to identify patient delay in the ED. Whoa, somebody didn't die. It wasn't like a JACO event, but it is a problem. And then we do a root cause analysis. So the answer, you answer your own question that you said has to be a problem for you to do a root cause analysis. Now, this question, let's say as a responsible party for quality improvement in a clinic, no, as a responsible administrator at your hospital, you are in charge to identify the delay of patient delivery from the ED to the psychiatric inpatient facility. Which of the following answers below would most likely align with the question? So here we do a chart analysis, review analysis. Well, you can play a trick in your mind, say, yeah, we're going to look at the chart to identify the problem. But here, I already identifying the problem. In this case, you pick a root case analysis. right? Because you want to identify what is the problem or the core of the problem in more detail with a group of people. You would not do
You have a
explain
specific
doing study.
issue that you're looking at, right?
Yes.
A
Yeah.
specific issue.
So when
Okay.
you do after that, we identify the issue. Now we want to do improvement in the clinic. Now the answer moves to a plan, do, study. Beautiful question. I love that you asked that. Very important to know. So we do a root cause analysis. Not only first thing that we need to take out of our head, because it's me too. Always believe that root cause analysis, somebody fell, the wrong medication. Well, yeah, it's true, but there is much more to that. When we do a root cause analysis, as a committee, we sit down and we bring everybody together and we brain search of the problem and we start analyzing. So it's not just because somebody fell, we're going to do a root cause analysis, or somebody died, right? It can be systems as well, okay? So perfect. Thank you for
So
asking that question.
basically,
Thank you.
the answer would be more honed in on a particular problem. Because I got this question wrong when posed in a different way on the main test, on my first assessment test. And the answer was root cause analysis, but I picked PDSA, and it was particularly the one about the challenges in the ER and the inpatient unit for transferring patients upon their arrival. And then you're tasked to examine the factors that influence the timely admission of patients to the unit. And then it asks to commence this project, you will initially conduct, and the answer is a root cause analysis. So you're saying because they've already determined that the problem is untimely transfers, then they're looking more for the root cause analysis.
Yeah.
Can I add to that?
Absolutely.
Can I add to that?
Please.
So basically how I see the question, basically with the root cause analysis, we want to find out why is this problem happening? What is the root cause? What is causing this problem? And that's where we use that method. But when we have the plan, do, study, act, that is basically focused on a continuous improvement over a period of time. So we focus in on what improvement can be done for over a period of time. And that's what we apply the plan, do, study, act is a evaluation. How do we improve the situation to, in a better path, if that makes sense. One is, why is this happening? Why are we having why are we having people discharge from the ER like after 12 or whatever? It's why is this happening? What are the factors that are influencing it versus evaluating what improvement can be done to better the situation, if that makes sense.
Yeah, it makes sense a lot. And thank you guys for asking and discussing those cases, because the more you are able to take out of your head before and actively before the test, the more I am able to assist you and others. Your students are your powerful, our community is the powerful magic, right? Because a lot of people are able to chime in, give a better examples. I don't hold the truth of everything, not at all, not even close. So people are able to clarify, make it better, and improve, and they just keep on improving upon. But the more you guys talk and let me know how and when you're getting stuck, the more we can discuss and and together lay a path for your successful PMHNP board certification. So yeah, there is no wrong question, right? There is the wrong time, but as we come together, this is the time to ask and validate any of your concerns, okay? So perfect there. One more to go, and then we'll be done, and then we'll be open. I'll be here for you for anything you need. And then we'll be just, cruising one more. Guys, I say that I make it painful, the lectures, in a sense that I want to answer your question, right? And there is a balance between time and the respect of your time. But I really feel that I want to get you to the point where you are unstoppable, to the point where you walk in the test center knowing that the only possible outcome is victory. And that will take some sacrifice from my part and from your part. Together, if you put the time, you become unstoppable. This test will not touch you if you put the time. I promise you. If you score like above 80 on my test, you will pass. If you score above 80 the first time, you will pass the board. I'll give you $1,000 if you don't. How about that? Promise you. If it's the first time and you didn't, you can charge me. Because if you've done the work and you are able to get 80% or more, and I see that you've done the work, I do not fear for you. I'd say go test it. And this is, I've done over 1,000 people have got their results with us. Over 1,000 people. I'm really able to say almost always with precise who will pass and who will not. I just got to look at the data. It's not magic. It's data-driven answers. Somebody asks me X, Y, and Z, I go back and look at their stuff. And sometimes I have to say, don't test it, please. And sometimes I said, please close the book and go test it now. Right? So, and sometimes there's in between, like I don't have an answer because it's very close. So, patience and
I have my exam scheduled for 20th of February. So,
yeah.
At what time do you think I should do the diagnostic?
So the diagnostic test 2 should be taken 10 days before your test date.
How many?
So you sit for the diagnostics 2, like you are testing for the board in a complete quiet room by yourself, no distraction, no notes. You take this as serious as possible. Like whether you get a 100 or whatever it's score, it's just a value for me and you, right? So there is no, you shouldn't be cheating. You shouldn't be, this is for you, like absolutely for you. So the more time you put in and the more you continue to do this on a daily basis, like study hard, study like your life depends on it. Like go there and pick up your certificate, nothing else, right? Because as we study and we pass the board, it is only the beginning.
Yes.
We'll be together like for a long time, as long as you want me to assist you. I get calls like from students that passed the board 2 years ago, all the time. So this is not like one-time deal. This is a community. This is a powerful movement. There's much more. It's much bigger than just passing the board, believe me. Right? So as we move on and we get better and better and better, as nurse practitioner, we're able to demand more and more and more.
I'm so grateful for the downloaded copies of Purple Book and others that because I can read it anywhere, anytime. Yeah. So it's very nice, that downloaded copy.
Yeah, absolutely. I mean, we'll go more in details, but let's wrap this up. So if you hear, it's all about patience. Especially in the board where all the resources are available and you have all the time and, everything is beautiful, everything is in the right place. So it's a patient-centered care. So patient-centered care model, PCC. So what's PCC? Is putting the patient at heart of their healthcare experience. So I do this a lot as I work with the organization that's very strong. But I tell my patient that I care about them. I do care about the organization because I'm employed by the organization, but I care about you as a patient. And I'm here to serve you as a patient, right? Even though it's kind of, without saying a lot of details of what I do, it's kind of hard sometimes to believe it. But I'm like, hey, I'm here for you, as not as a friend, but I'm here as a professional advisor to say, hey, these are your options. And I put you at first. And, as long as you don't tell me something that's extremely crazy, you can tell me about anything you want, right? Because there are some things that I have to report, right? So focus on the individual needs and preference. That is PCC model. It is not one size fits all approach. Sometimes have to be strict. Sometimes have to be playful. Sometimes I have to be relaxed, depending of the situation. Doctors and nurses work together with patients to understand their unique goals. What's important for them? What are your concerns? How can I make it better? What do you value? I always say at the end of all my interview, I ask the patient, what do you think of the plan? How would you like to change this plan? And I give them the option. You know, we don't have to take medications. We can do therapy. I'm not going to do therapy because I do mostly meds, because they don't have a lot of people that can do meds. We can do therapy if I have time off. Usually I say, hey, I'll direct you to my friend that can do the therapy, and I'll work with you with medications. If you don't want a medication, you can start with therapy, and then we can wait 2-3 months and reevaluate the situation, right? So it's a shared decision making. Just because I'm the prescriber, it doesn't mean I have control. It doesn't mean what I say is the right thing for you. It's just a suggestion based on research, right? So putting the patient at ease, as in we're a team, not that I'm the doctor and you're the patient relationship, it's helpful. Instead of just telling the patient what to do, you take this medication, blah, 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 do not deviation, right? It's kind of the doctor involves them in the discussion about treatment options, risks, benefits. Patients have to say their care plan, you know, having the care plan. One of the things that I did recently is I called the inpatient unit. I'm like, hey guys, what are you guys doing? You know, what do you mean? They're like, well, basically your patients are leaving the inpatient and coming to me, and they don't have a safety plan in the chart. Oh, we did one, and we you know, take a picture and give it to them. I say, yeah, but was it documented? No, if it wasn't documented, it never happened, right? So that safety plan needs to be in the chart. Yes, you need to take a picture and give it to the patient because the patient needs to utilize it, but you need to add all discharge needs to have a safety plan in the chart, every one of them, because this is going to cause a lot of problems. Plus, as they leave the inpatient, they come to me. Now I have to do the safety plan, and that can take another 40 minutes that I don't have, right? So working together with the patient is important as well, right? And preventing lawsuits, right? We don't want to get there just to be sued. And that's why I say the psychopharmacology courses main reasons for the patient, but also to protect you. Okay. So respect and collaboration, holistic approach, perfect. Anytime you see holistic approach, it equals nursing, right? It's considering the physical illness and the patient's mental, emotional, and social well-being. That's like nursing all over the place. Social, cultural competency, understanding that my way of doing things scientifically may not match what the patient consider is the best for them. So respecting, giving the option, but also respecting what the patients want to do. And sometimes is a timing process. You cannot tell someone what to do if they are not ready to listen. So you just have to be by their sides and wait for the right time to provide the idea. If someone does not want to listen, you know, I give an example, someone that's very rich, super rich. Do you think they care about money problems? They don't, because they don't have a problem. If you want to talk about money problems, let's talk about to regular people like us, and we can talk about money problem, right? So basically, I'm saying that, hey, they have to be ready to listen, right? Social competency is important. Anytime you hear culture, look for a weird answer that involves culture, right? It can be folks medicine. It can be like what's normal for them. Help me understand what's there in your culture. Okay. So quality improvements and reflective practices, as we mentioned, that's not necessarily. Here's the PCC model. If you look at the medical model, it's like patient role is passive. This is what you're going to do. I remember doing rounds in ICU, and we taught this in front of the patient, but the door is closed, right? So the patient's not involved versus, hey, this is your care. So I'm meeting with the intensivist, the nurse in charge, the nurse manager, the patient. And now we're going to talk about your care in front of you. What your CBC looks like, what's this infection is doing, how many days do I have an antibiotic running, what's the epinephrine rate, all this in front of the patient. And they say, hey, what do you think about that? You know, is there anything that usually the answer is no, nothing, everything is good. But sometimes it's like, yeah, I've been served 5 times mushrooms and I'm allergic to mushrooms, you know. Luckily, I didn't eat them. It can be something serious. So including the patient, active role versus passive role, and many other different scenarios, as you can read, that is important. But PCC, holistic, including the patients, is what you should remember of. Okay. So what else we got to cover here on this training number 9? So few things to know, right? They go beyond the individual behavior. It is not just about the personal choice, but about the broader social issues like poverty. Somebody has a hot mic there. 1 second, please. See who it is. Okay, thank you. Appreciate it, man. It's about social issues like poverty, discrimination, and lack of accessible care and resources, and include poverty, housing. This here, we're talking about what, guys? It's not in the slide. We're talking about disparity of care, right? So, like, we're talking about, let me go back here because it should be here. 1 second. So when we look here, social, I skipped it, my apologies. So when we look at here, we're talking about the social determinants of mental health are, what are they? This is important, and my apologies for skipping. The social and economic factors that influence a person's risks of developing mental illness and their ability to access and benefit from mental health. So anytime, write it down, please. What are the social determinants of health in general? Equal anything that precludes the patient from accessing healthcare. Poverty, lack of a car, discrimination, age, any kind of discrimination. It can be color, age, language. All this affect us, right? If I don't trust the healthcare provider, do you think I'm going there? Well, whose fault is it? Is it my fault that I don't trust, or is it their fault that they have done something in the past that I don't trust them? I'm not here to judge. I'm here to solve the problem. So whatever it is, we need to close the gap. That's it. So just not about personal choice, but about broader social issues like poverty, discrimination, lack of access of resource. Do you think I'm going to, okay, I would love to take my meds, but I don't have money for the bus. How am I going to pick up the meds, right? So keep that in mind. Anything, violence, trauma, discrimination, racism, limited access to healthcare and education. That's all social isolation, unemployment, language, right? If I can't speak English and you give me things in written material, does it help me? Well, I provide the patient the material, but it doesn't yield the outcome, right? So they disproportionately impact certain groups. That's true. People with lower socioeconomic status, racial and ethnic minorities, LGBTs, individuals, and people with a disability are often more vulnerable, right? We all can agree with that. It doesn't mean that everyone in those categories are affected, but they proportionally they are affected more than the people that have the means. They can worsen mental health outcome. Think about being stressed over time due to discrimination or due to lack of resources or due for whatever reason, right? What happens? I'm going to feel hopeless. I'm going to feel chronically stressed. I'm going to have a lack of control, right? At one point, I'm going to explode, right? Increase the risks of depression, anxiety, and mental illness, right? So addressing them is crucial. If you want to improve mental health, address disparities in mental health care. And that's my light bulb thing, right? We want to not just have more access to mental health, but we want to provide mental health to those in needs that may not have someone to advocate for them. And that's the ultimate goal of our profession, not just pharmacy, you know. So social determinants of mental health behaviors are areas that emphasize the roles of a multi-level social and structural factor in shaping mental health and behaviors. Stigma. Stigma every single day. I have somebody in my office every single day. Oh, I didn't want to come to mental health because I didn't want to affect my career, blah, blah, blah. It's a stigma, right? So one of my main goals is to decrease the stigma in my organization, right? It's okay to come to mental health. It's okay to feel vulnerable. It's okay to discuss your case because sometimes it's not really your fault. You know, you didn't ask to be depressed. You didn't ask to feel anxious. You didn't ask to be in this situation, right? Social network, structural racism, policies, housing, drugs control, criminal justice, right? So risk factors that for many common mental illness are heavily associated with the social inequalities, where the more significant the inequality, the higher are the risks. So hopefully you get the gist of it on these things, and as soon as you see it, you'll be like, boom. So recall, reflective practice means debriefing, right? Bridging the gap. Learning from experience is reflective practice. I want to take it away. What else? Well, let's do a checking on learning. Could I have a kind person to read this one for me? Don't have to jump over.
Senior female immigrant who relocated to the U.S. only 2 months ago has come to your clinic for assistance. She struggles with English language skills and cannot read or write in English. As a healthcare provider, what would be your primary action to ensure equal care for this patient? A, addressing race and inequality. B, address age-related concerns. C, to address her reading levels. D, address health literacy. Let's see.
Let her answer, please. Nobody jump.
Yeah.
This one's confusing.
I guess in her own words, I would try to get her to, well, she can't speak English. So address her,
Okay, so let's
I mean,
this.
she can't read, so
Okay.
this is, yeah.
So let's do this. What is the core of the question? What is the question asking you?
It's D.
Wait, guys, don't jump. Don't jump.
What
what's
would be the primary action to provide, equal care to this patient that could not speak English?
Okay, so that's great.
Relocated a couple months ago.
Okay, okay. So the core of the question is providing care to a patient that does not speak English. So you have to, every question from now on, synthesize what is the core of the question. So how would you solve this problem without looking at the answers? How would this problem be solved? If she cannot speak English, how would you solve this problem?
Her reading levels. I mean,
Okay, so that's a good answer. Her reading levels. Now you're looking
so
at
she
the
can't.
answer.
Yeah. Mm-hmm.
Or you look at
Oh,
the
I
answer.
don't.
Yeah. Wait, guys. So let's analyze it. So you look at the answer, you saw reading levels. Do you think reading levels is above or below health literacy? Addressing health
Okay.
literacy, right?
It's
So you have a
above.
higher
Yeah,
hierarchy.
address health literacy.
So you
Health
have a
literacy.
higher hierarchy here, right? So reading is just 1 point, but health literacy, right, is many points.
Yes.
Oh,
Mm-hmm.
So you actually have the answer on the tip of your tongue. You just need to, even though the answer you arrived is very good, but you have a broader umbrella answer. It's like if I say I want to learn how to read versus learn how to read, write, implement, work. Which one would be the broader answer, right? So yeah, great job. That I appreciate addressing health literacy would be the bigger umbrella here, right? So what
Umbrella
is that?
question. Answer.
Yeah, so there'll be the education. So literacy, language, things like vocational training, higher education will be kind of an education in general, right? You can say healthcare coverage would be the bigger umbrella thing. Okay, so yeah,
Okay.
great job. But for every
Thank you.
question, guys, go for this first. What is the question asking me? What's the core of the question? Synthesize that in one phrase, and then answer. How would I solve this problem? And then match your answer. Sometimes your answer may not match perfectly, but most of the time you got the answer. Why you didn't is because you got confused with so many choices. You're tired, and you know a lot of things is happening. Well, I actually, Giovanna, you are here, and I just got your email like a few hours ago when I woke up.
Yes, sir.
All right, so congratulations. Super glad to see that you're back. I'm super happy. I couldn't
Well,
answer you.
I'm taking the ANCC on Monday, Dr. Lopez. So I
Oh,
took
so you
this one today, and I'm gonna take the ANCC on Monday.
hey, I told you, go ahead and test it. You are unstoppable, and congratulations. So, I say to people, go ahead, test for both, right? Uh, go ahead. You're doing the training, you're doing the work. There is nothing, no one can stop you. On Monday, you come back being double certified. That's just a fact. Let me put that way, okay? You will pass on both. Promise you. So as you walk in Monday, you're just walking like you walk in Starbucks. Give me my coffee. Give me my certificate. As simple as that. All right.
Thank you,
So
sir.
yeah, congratulations. Super happy to see your email this morning. I couldn't answer yet, but I certainly will. Okay. Good job. Anybody else has a question about anything? So let me answer a question first, because I think this is important. Okay. So when you test for the first time, that is your best choice, your best chance of passing. Okay. Oftentimes, half of my students, they found us because they didn't pass. So then they're like, oh, let me try this program. And they came to us. And that's fair and that's okay. And I love to have them. But now we're going to have to work it a little bit harder. Okay. Why? Because every time we have a trauma, it decreases our capacity to act positively, right? So if I'm spit on all the time, you think I'm going to be positive about it? No, right? Obviously. So if you tested once, testing is a nerve-wracking, and it's the most important test of your life. Let's acknowledge that to begin with. And you did it once and you didn't pass, right? And often there is a resistance. Oh, I want to do things this way or that way. So now I have to work with you little by little to like, hey, follow the program. Here's the step, do X, Y, and Z, right? And then comes, oh, I know what I have to do, and I just want to do a question bank. I was like, that's fine, but it didn't work. So my point here is that the second time you take it, if you don't pass, the third time will be almost impossible. Guys, I'm not trying to sell you something at all, because all of you guys are in a course, but I'm trying to guide you the right way. The third time it becomes virtually impossible. So what is that to do? Don't take it, the ANCC anymore. Go for the other test. Now, before you go to the other test, let's bring you back and trying to find the root cause analysis of the unsuccessful event, if that happens with me or with somebody else, right? So we have to take the test like it's a fight. We're going to fight for every question. We're going to do it the right way, and we're going to accomplish this. So don't jump the gun. Don't be too fast. We all wanted to have this done by Christmas, right? But it's okay. It's totally okay. I'm here with you as long as you want me to be here with you. I don't even charge if it's over the 6 months. Completely free. As long as you want me to help you, I'll do my best, right? So what I'm saying is do it right, guys. Do it right. So what's the right way? In my mind, at least, this is what I would do. Complete module 1. Complete the pre-test. Don't look at the answers to begin with. I know everybody looks, and that's hard not to look, and I got it. Maybe I shouldn't put answers. But anyways, do the pre-test. Do module 1. Print your PDF. Do all 2 question bank module 1s. Now look at the PDF. 23 topics. There is 23 mini classes. Are you able to talk about those classes in detail to yourself just by looking at the title? What do you remember about lithium? What do you remember about carbamazepine? What do you remember about suicidality? Whatever the topic is, you should be able to mentally state it and be very good at module 1. Now you master module 1. Now you do module 2. You complete all the videos on module 2. Do all 2 question banks on module 2. Look at your PDF. Master the topic. Now you move to 3, 4, and 5 in the same exactly manner. By the time you reach 5, you have done 1,400 questions. Done. Module 6. Every line in the test, in the course, it's important to you. Every line. So know them. Like, know what I'm talking about. And if you
I don't have the question bank. The one I have is just 10 questions per month.
Okay. Yeah, Betty, we'll address that in a quick second, please. But thank you for letting me know. We'll address that in a second. So then you do the module 6, which is the crash course review. Guess what? I included in the PMHNP, so you don't have to buy it. I included in the question bank, so you don't have to buy it. I included in the diagnostic test, so you don't have to buy it. So you can have all the resources available to you, rather than charging you like 5 different times for 5 different things, because that's not fair to nobody, right? So, and attend the live classes, because the recording is great for some people, but can we always make it better? Can we always ask different ways? Can we always do a different voice intonation, right? So your preparation absolutely determines your success, right? And we'll be here. 2025 is here. It's going to be a great year for all of us. So now I'm open for questions. Any questions? We're on module 5. So we went over modules 1 through 5. If you join us today, it's okay. Totally okay. You don't have to go in order. So basically, what I ask you is just to go to diagnostic test next week. I'm sorry, the PMHNP crash course review next week, and then we start back again on module 1, and we'll go back in sequence. The orders of events do not matter. What matters is the content, and you master the content each week. It will take some work. It's not a quick fix. Oh, I'll just listen to Dr. Lopez and eat popcorns and play with my dog. It's not going to work. It's not going to work. Okay. And I try to tell it how it is. Not here to take anybody's money. I'm not here to, let's work together. Okay. Yari, you have a question there?
Yes, Dr. Lopez. Can
Hi.
you hi, can you please show us like where the question bank is? I mean, like when you finish each module, like I just bought like the flashcard, and I also bought the question bank for I think that was 99, and the flashcard for $49. So that is what I'm trying to do. But you always talk about finishing each module and doing the question bank. So I did not see that. So I just went ahead and I just bought like the question bank. I just newly bought it like yesterday. So but I just wanted
you
to
just have access to the question bank, right? So really, yeah, that's all you have access to the question bank. Stay put. Are you sure you're not on a PMHNP 30 days walk to success?
I don't know. I just registered for the course, and when I go to like I go like you always talk about having questions after each modules. I haven't seen that. I just
So a few modules, there is few questions there, but these questions are not what I'm talking about. Questions that I'm really want you to do is the question bank.
Can you show? Can you?
Yes, I'm
Can
going
you
to show
please
you
show me?
right now. So let me show you the question bank. So for those that says, hey, I don't have the question bank,
I don't
I
have.
want you to do something for me, Betty. And it's possible that you could, because of manual process, but it's very possible that you do have received it, and it's very possible that it is on your
30 days.
No, that it's on your trash bin. Okay, and I'll look right now if you do or you don't, but it is most likely it is on your trash bin. Okay, so it means you received it, you just never accessed it. So I am on a question bank right now. So this is my view of the question bank. Okay, so let me go back here a little bit. My view may be a little bit different. So I have two websites. Why would I have two websites, right? So basically, if something goes down on the main website, technology can happen, right? I don't want you to be stuck with like not having access to the things that you need, right? So I have two websites. So once you arrive to your question bank, the first one that says 1, can you guys see it?
Please, I don't. That is. Yeah. I don't have this.
I'm seeing welcome to PMH question bank. Is that the one?
Yeah.
Okay, let me open it and see.
So here, once you assess, there is two types of question bank. Number 1, it has scientific foundation, advanced practice, diagnostic, psychotherapy, and ethics. That's a complete set.
Is it the one with 10 questions?
I'm sorry?
Is it the one that has 10 questions each?
No, hold on. We'll share your screen in a second. So when you're on the right screen, so you have 147 questions on scientific foundations, 100 questions on the advanced practice skills. What's that? 104 questions on diagnostics, 100 questions on theory, and then you have 100 questions on culture. right? So that's the focus one. Now, once you finish that, let's say you did the foundation. Hold on, guys. Then you should jump to the next one, which says foundations, block 1 and block 2. Now you finish the foundation, or you're on module 2. So you come back here to advanced practice skills. You do all these 100 questions, and then you kind of slow, and you come back here and you do advanced practice skills, and you do all these questions, which is probably like another 200 questions, right? And then you do module 3, video. Somebody has a mic on, kindly, please. Then you have 3, and then you have another one, 104 questions. And then you come back here and you go another 120 questions or something like that, right? So it's very important, because now you're not only getting the information, but you're applying the information, and you're getting the information in different ways, in different language, and sometimes closely related, and sometimes totally away from what you learned. And there is a good thing about that, right? Because we cannot cover, and we should not cover everything, because if everything is important, then nothing's high yield, right? So we want to cover a good 85 to 90% basis that you will absolutely see. And there will be 10%, and that's mostly, I'm counting on the question bank to cover the other question bank, to cover another 10% of things that we didn't cover. And that way you'll be, super ready for the test. So there is absolutely no way possible that you can do 1,400 questions twice and watch the videos, learn the PDF, do the diagnostic test, and not pass. I challenge you to follow the program and not pass. This is a true and tried program. Now, when we have negative outcomes, because we do too, not very often. We had, like 3 weeks ago, we had like 3 people that didn't pass. It kind of blew me away. But then we looked at the statistics. I looked at the test, and some of them I said, please don't do it because you haven't done the work. Oh, but I want to be done by Christmas. Sure, I got it, right? But we have to work hard to get that together. All right. So if that disappointed some people, and I do apologize, but I just don't want to see you fail. Okay, I want you to see it's no fail mission at all. And that means we have to put a little bit more work than most, but the resources are available. It's just a matter of setting the time, 2 hours a day, keep doing it 2 hours a day. Boom, boom, boom. Just like you drink water, just like you eat food, you need this to pass. You study hard. Okay. So that being said, it's a long night, and I don't like to make it a super long night. So I'll stay behind for anybody that's having problems, issues, or concerns. But the rest of you guys that are tracking, marching in the right direction, I don't think there is much of a teaching value for this lecture. So I do thank you guys. Super stoked, happy to have you guys in the course, and it's an honor to always be of any assistance. Mary Basile, do you have a question there, man? You have to unmute yourself, Mary. Mary is trying to get on the phone, I believe, but she's muted. All right. So Mary, please unmute yourself if you can. I cannot hear you.
I just need a question back.
All right. While we do that, while you unmute yourself, Mary, Senzing Health. Hi.
Yes. Hi, Dr. Lopez. I just wanted to show you my screen. I had the question bank initially. Now it's not there anymore. Okay. Can I show you the screen right quick? Because I'll be
share the screen.
Okay. I'll be really fast.
Okay. While you do that, let me ask her a bad question, then we'll be back to you, okay?
Okay.
It's the same question bank.
Okay,
I'm
let's
not
look
getting those ones that you said there. I have only the one, take me there 10, take me there 10.
Okay, Betty, did you check your trash bank, your trash bin?
Okay, I'll do that. I'll call you back.
Yeah, look for
This
NP exam
project. So
code.
I have the same problem as you. I was trying the modules and then I don't have any question back. So I emailed Dr. Lopez and he sends me an email with a link. So when if you get that email, I don't know if you have it, Dr. Lopez, if anyone can forward it to her or how does it work? I can do that.
You have to speak up close to your phone there, so we can hear you.
This is the
Yeah.
email. Remember you had changed my email
All right.
address. This
Oh,
is
perfect. So can you open your screen bigger?
Oh, it's not. Oh. Can you see that?
Okay. You took it as out.
Oh, I took it as out. Oh, can
Yeah,
you see that?
here you go. Now on the right upper side, can you make it larger? On
Okay,
the
right here.
Just, I mean, sure, that's okay. Can you scroll down? Oh, actually, I'm sorry. Can you scroll up, up, and then where we are located here? I can't see it. Can you move that screen to the right side? There you go. Perfect. Now, can you go to? Sure. Yeah, go ahead, please. All right. So now refresh it. That screen.
Refresh the screen.
Yeah, just refresh on top. Okay, you didn't refresh. You went back.
Yeah.
So can you go worse? Yeah. Now refresh the screen on top. Perfect. Okay. All right. Can you take that thing that's in? Here you go. Perfect. Right there. Try again. Start again on the red button. Yeah. Here you go. Now you are in.
Okay.
Now
So
can you go down?
okay. Right.
Now, okay, everyone. This is very important. Where she's at. Can you take my screen out that you are sharing? The conversation.
You said take this screen.
Yeah. Move to the left.
Okay.
All right, everybody, pay attention here, please. Very attention. Where it says continue is where you're gonna press. Continue.
Right here.
Yeah. If you press question bank, it's gonna ask you to pay again. You already paid. I already put you in the course. Now, can you move the screens that are that want you from the left side? Yeah. Yeah, you can. There you go. Now we go back. Here you go. Perfect. Yeah, here you go. Perfect. If you can move that screen to the right.
Your screen. Okay.
Now you have a first set of question bank that has all 5 modules. You're gonna do number 1 there, right? So which is a scientific foundation.
Click ready to start this right here.
Yeah, you can do ready to start.
Can we go back? Because I think that's where I'm getting. I just wanted to see what I'm okay. So it's right here.
Yeah, so you say complete. No. You write that. But can you show her on the side complete or something? No,
right
the bottom but below.
Below?
Here you go. Up. Where you press to start.
Right here. Continue.
Sure. Yeah, continue right there. Oh. If you don't press continue, it's going to take you to the question bank and it's going to say, hey, would you like to buy?
Okay.
Because it doesn't know. Okay.
Okay.
And then you start. Now, I want to show you one more thing here.
Okay,
if you
screen.
Yeah, there you go. If you finish, like, say you finish all this 100, now you move to module 2. Then you want to go to number 2 here, right? But before you go to number 2, I want you to take the module 1 below. See, below?
Below? Okay.
Yeah. Where it says scientific foundation, there is 2 modules there of 20 questions each. No, on top.
Domain 2.
Domain
Advanced
2.
practice skills.
Oh, I'm so sorry.
For domain 3.
Right here.
Yeah.
Okay.
Now let's say you finish module 1. Now you go back to the lectures, listen to the lectures, and come back here. So you go to module 2, question bank, on top.
Okay. Right
Can
here.
you show them? No, on top.
Oh, module 2. This
is
module
2. So there is you go 1, go below. There you
right
go.
Here.
Module 2. And then you do all this question bank. Once you're done, you go down again. Down. Now you have another 200 questions here. That's module 2.
So
you keep moving this manner.
Okay, so
You do,
this is module 1, 2, 3, 4, 5.
yes,
And after that, then we have to do 1 and 2.
and there is more. 1, 2, 3, 4, and 5.
And we'd have to do 3, 4, and 5.
Yeah.
Domain 2, 3. Okay.
Yes. So that way you are doing 1,400 questions. It becomes virtually impossible for you not to pass the board. You have to be, if you do it right, not just clicking, right? If you do the process right, it's impossible almost to not achieve the results. When we have negative results, I look at the numbers. Oh, didn't do diagnosis test 2 or 1, didn't do question bank, didn't do
It's a lot.
all the reviews.
Yes.
So, you know, it's difficult. And I'm not blaming anybody. I'm just saying, hey, we have a process that we've been validated with over certificates, 1,000 certificates. We know the path. It's all a matter of putting the time. I can't do that. That portion, I can't help, right? But the process is here. And many people, many people have said, hey, even though this is a course preparation, I have learned more about psychiatry during these 3 months that I spent with you than my entire nursing career. Because you're really going to get yourself prepared. It's not a watered down, oh, hey, just come here to this Zoom class and you're done. This is not it, right? On purpose, too. So, all right. So thanks for sharing that. Appreciate it.
You're welcome.
Anyone else is having issues, I can be more than happy to assist.
Dr. Lopez?
Yes, Dr. Lopez, before they go,
Yes.
So Dr. Lopez, I was just asking, so the flashcard, we have to buy it separately? Because I just kind of bought that again. Then I
Yes.
bought another question bank for $99 because I wasn't assessing what my colleague was just showing. So I just went ahead and I'm like, you know what? I have to just buy it because I was just like not doing
Yeah,
anything.
no. Yeah, I get it. So just email us. I mean, on top of my head, I don't know who bought what, Yvette, but I'm pretty sure, like almost 99% sure that you have the 30 days PMHNP, right?
That's what I haven't really seen, but well, yeah. So I
But
just
have
went
you
ahead.
watched the videos?
I'm watching the videos. Yes.
Okay,
I'm
so you
watching.
do
I
have the,
I started from module 3, so
yes.
I just continued. So
Uh-huh.
this is So I will have to go back and watch module 1, but I took like
Yeah.
the diagnostic test. So, but I was just like, okay, I really need to practice some questions before even going ahead, so that So
Yes. So it's very important that we don't, that's why, some people can finish in 3 weeks, but maybe they don't have a husband or wife, they don't have kids, then maybe they do, maybe they're not working. I don't know. It's all possible. But some people may need a little bit longer, and that's totally okay, right? So yeah, in fact, please email me if you have any concerns, if you overpaid for whatever. I don't know. The system, just
no, this
take,
one is just like I paid for it like I think 2 days ago or something, because I'm like, I cannot just be watching the videos without practicing questions or doing, just looking at I
yeah,
downloaded the PDF and all those things. So I just
right.
went ahead and
So yeah, no, it's included in your program, and just ask for a refund. We'll go ahead and do that for you, no problem. So the only thing that's not included is the PMHNP flashcard, and the
Okay.
reason I cannot include is not my app, it's Brainscape. I'm using their technology, and I think it's fantastic. You would be hardly pressed to find a way to study that's more effective than Brainscape. Why? Well, we started with 1,000 cards, and then you can I know this and I don't know this. It's only going to show you the things that you don't know. So that's effective study, right? It's not effective to go through Quizlet 1,000 times over and over again. The things that I know, I need to let it go. And the things that I don't know, that's what I need to focus on.
Okay.
Now, you want to make it even better. Get the PDF on one side of the screen, go to your exclusive Brainscape Pro, because you have exclusive access to all flashcards on Brainscape, and make it your own. Take a week to make your own flashcards, because now it becomes much more memorable. You can put inappropriate things in there. You can put things that is only good for you, or only you understand, whatever. Make it personable. Add pictures. Take a week, pause, and go through each one of those PDFs and make your own flashcard. That's even better than my own, because it's yours. You know, and if you do that, you'll be able to go through all the flashcards, all the modules in 3-4 hours, because you already went through once. Now you're going through only the flashcards. Boom, 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 boom. And you can do that while in the bathroom. You can do that while waiting for your food. You can do every time you're not doing anything, pull out the flashcards and keep going. I remember like doing almost about 800 flashcards a day. You know, going through school like very, very fast, because I already knew the material and I was just cued in on things that I didn't know.
Okay.
All right, guys. Any
Dr.
other
Lopez,
questions?